Hi everyone, welcome back to my channel. I am Dr. Prabhjit Singh, MD Anatomy from AIIMS Jodhpur. I know बहुत टाइम को वीडियो बना रहा हूँ. I'm sorry, I was really busy. कुछ workshops थी, कुछ अपने काम थे. I was really occupied in past 10 days, but I'm trying my best to keep up with the flow. So today's video, it is going to be about the spinal cord. I'll be focusing from now onwards on neuroanatomy. सो एक एक करके कोई ना कोई वीडियोस आने वाली है. सो आज का वीडियो इज अबाउट द स्पाइनल कॉर्ड. सो वी ऑल नो स्पाइनल कॉर्ड इज अ पार्ट ऑफ CNS. It is an extension of the medulla oblongata. Okay, it extends from medulla oblongata to कहाँ तक is the biggest question. So to कहाँ तक it depends. It depends from age groups. So from medulla oblongata to in kids, or you can say at birth, it is till the level of L3. In adults, N1 L2 junction, and then in fetus of about 10 weeks, it is occupying whole length of vertebral column. Now what's the reason कि with age इसकी जो length है या वो कुछ भी कह लो ऊपर होती जा रही है, because the spinal cord and the vertebral column दोनों चीज़ें grow हो रही हैं, but vertebral column is growing faster than the spinal cord, so vertebral column ज़्यादा बड़ा हो जाता है, spinal cord उतनी बड़ी नहीं हो पाती. So that's the reason of the discrepancy between the length of spinal cord and your vertebral column. Okay, so that's one thing. Now you must have seen कि when the spinal anesthesia is being administered, the person is asked to flex the back. Why? Because when the back is flexed, in flexed torso, it is up to T12 L1 junction, just for the safety. Because the spinal anesthesia is given below the level of spinal cord, normally spinal anesthesia is given at L2, L3 or L3, L4 levels. So what is the length of spinal cord? The length is about 45 centimeters. तो बॉडी में 45 सेंटीमीटर का क्या क्या होता है? sartorius muscle, esophagus and spinal cord. These three structures are of the length of 45 centimeters in the body. Then the coverings. So we know that the spinal cord is covered by meninges. So from outside to inside, what are these meninges? The first one is dura, the second is arachnoid, and the third is pia. So then you can do it like DAP. The mnemonic is DAP. So what are the extent? They all start from the brain only, but till where? Dura and arachnoid, they are basically till the level of conus medullaris, and pia mater is till S2. Now what is conus medullaris? This is the spinal cord. When it terminates at L2 level, it terminates like this. L1, L2 junction, you can say terminates like this. From this part, it gives off multiple nerves on both the sides. So what is it looking like? It's looking like घोड़े की पूंछ. So these nerves are known as filum terminale, and this triangular part of termination is known as conus medullaris. So now Phylum terminale is covered by only pia mater, not by dura or echinoid, because dura and echinoid terminate over here L1 L2 junction and pia is still S2. The phylum terminale extends even beyond S2. But phylum terminale के दो parts होते हैं, क्या होते हैं, कैसे होते हैं, we'll have a look in few minutes. Just understand, phylum terminale in general is covered only by pia mater. Now, very important thing, the difference between cranial and spinal dura. Yes, the dura के अंदर differences होते हैं. So on this side cranial and on this side spinal. The cranial dura is comprising of two layers. It is only comprising of one layer. So what are the two layers? Endosteal and meningeal. Endosteal is the outer and meningeal is the inner. In spinal, only meningeal layer is present. First. Second is foldings. Foldings are present and absent. Foldings मतलब आपकी जैसे कि falx cerebri, falx cerebelli, tentorium cerebri. All these things are the foldings. So these are present in cranial dura, absent over here. Now the third point, subdural space. It is absent in cranial and present in spinal dura. So these are the three differences between the cranial dura and the spinal dura. Now next. The processes of spinal cord. So there are four processes. The first is phylum terminale, इसकी हमने अभी बात करी. The second is linea splendens. ये हीरो होंडा वाला स्प्लेंडर नहीं है, this linea splendens. Next is subarachnoid septum, and the fourth is ligamentum denticulatum. So these are the four types of processes of spinal cord. So let's have a look at these one by one. The first one, phylum terminale. So phylum terminale क्या है? घोड़े की पूंछ है. ठीक है जी, घोड़े की पूंछ है. बट ये जो घोड़े की पूंछ है, it's also comprising of two parts. Just a sec. ज़्यादा बड़ी बन गई थी घोड़े की पूंछ. Comprising of two parts. So some part of it is covered by pia mater. So the part that is covered by pia mater is known as phylum terminale internum, and the part that is not covered by dura mater is pia mater, phylum terminale externum. पूरी की पूरी phylum terminale is not covered by dura and arachnoid. It is covered by पाया, ये इन जनरल अगर क्वेश्चन आता है, आपको स्पेसिफिक आता है तो फंडामेंटल इंटरनम इज पार्ट ऑफ फाइलम टर्मिनले covered by pia, so it extends from conus to S2 and it is beyond S2, not covered by pia. I hope this is clear. These are about the two parts of phylum Terminale. And now let us study about the 2 points together, linea splendens and subarachnoid septa. So the spinal cord was covered from outside to inside by dura mater, arachnoid matter, pia mater, and then you have the spinal cord. So now we need to draw a diagram of the same. So this is the spinal cord, this is the central canal. So the innermost lining that you're going to have, it is going to be of pia mater. Then the lining that you have is going to be of arachnoid matter. So red wala is your arachnoid matter, green wala is your pia matter. So linea splend, and if I have to draw the anterior posterior, this is anterior and this is posterior. Is it clear? So the linea splendens is present anteriorly and it extends till pia mater. This is the linea splendens. And the subarachnoid septa, it extends from posterior aspect. Just a sec, let me make some improvements over here so that you can able to understand it better. Okay, subarachnoid septum is like this. It extends, so it's this. It extends from the arachnoid matter to the spinal cord, but it is fenestrated at the level of pia mater. So linea splendens and subarachnoid septa के बारे में हम थोड़ा सा लिखेंगे. Linea splendens and subarachnoidal septa. It is present anteriorly, it is present posteriorly. From spinal cord to pia, from spinal cord to arachnoid matter, but fenestrated at the level of pia. Because spinal cord से arachnoid जाना तो obviously pia को cross करके ही जाना पड़ेगा. Because these are the coverings, and outermost covering that you have over here, that is dura. So I hope that is clear. Itna. Now the next thing is basically the external features. But before going to that, note down something. The spinal cord ka thickness is little bit more than the usual, and that is known as the enlargements. So there are two sets of enlargements, one for the brachial plexus and one for the lumbosacral plexus. So brachial plexus वाला कहाँ आएगा? Mainly cervical region में. Lumbosacral plexus वाला कहाँ आएगा? Lower lumbar upper sacral region में आएगा. So the enlargement for brachial plexus is from C5 to T1, that is the root value of brachial plexus. The other one for the lumbosacral plexus, that is from L2 to to S3. That is again the root value of lumbosacral plexus. Now let us have a look at the structure of spinal cord, external structure, not internal. Internal अलग से बात होगी, external अलग से बात होगी. So somewhat like this. I know थोड़ा proper नहीं है, काम चला लेना यार, इतनी अच्छी ड्राइंग नहीं है मेरी. I am not an artist, unfortunately. Okay. Now you have the anterior horns and the posterior horns. Okay. So yellow wala part is your gray matter and this is your white matter. So let us label the white matter for instance. This is the lateral column. This is the anterior column. This is the posterior column. Is it clear? So now I'll erase the white matter and इसी में मैं बनाऊंगा आपका बाकी के structures. Okay. So anteriorly, if you see, there is this cap kind of a thing, and posteriorly ऐसा कुछ नहीं है, सिर्फ एक septa सा है posteriorly. So this is known as the posterior median septa, and this is known as anterior median fissure. And over here you have something which is known as anterior spinal artery. So anterior spinal artery is the content of anterior median fissure. Then you have this bend kind of a thing. This is known as the anterior lateral septa or sulcus. Okay, and over here you have again posteriorly two structures. This is posterior intermediate sulcus and this is posterior lateral sulcus. These are about the external features of spinal cord. Now what you need to remember कि the posterior horn is at the level of posterior lateral sulcus and anterior horn is at the level of anterior lateral sulcus. So that is all about the external features. Now let us talk about the internal features. Oops, मेरी ink कहाँ गई सारी? आ गई वापस. I was like ink कहाँ गई? Okay. So for again internal features, I'll just draw the gray matter only. So this is the lateral horn, anterior horn and posterior horn. Lateral horn मैंने क्यों बनाया? It has a specific role. Lateral horn is not present throughout the length, but it is present only at certain locations. The lateral horn is present from T1 to L2 and from S2 to S4 for sympathetic supply and for parasympathetic supply. Obviously, it is present bilaterally. So if I'll draw it on this side also so that you guys don't get confused with it. Okay, so now let us study about the various neurons that are present in the various parts of the spinal cord. So you have a neuron over here, इसका नाम है posterior marginal. Then in the posterior horn, you have a neuron. This is your substantia gelatinosa. Then you come across something very big and something very important, that is nucleus proprius. So I hope ये तीनों clear हो गए. उसके बाद में you have two nucleuses over here. Now one on the lateral side is your visceral afferent and one on the medial side is your nucleus dorsalis. इतना clear है? Now in the lateral horn you will have two nucleuses. One nucleus will be present at this level and one at this level only. So the important point to note over here is this one is your intermediate lateral from T1 to L2 and this one is your intermediate medial, that is from S2 to S4. I hope it's clear hai? Now let us move on to the anterior horn. Anterior horn is going to three columns: intermediate, medial and lateral. So this is your medial, this is your lateral and this is your intermediate. So the lateral is further divided into three. 1, 2, 3. So this is your lateral. Lateral is divided into 1, 2, 3. So 1 is ventrolateral since it is in anteriormost ventrolateral. 2 is dorsolateral and 3 is retrodorsal. So ventrolateral lateral आगे वाला, dorsolateral lateral पीछे वाला, retrodorsal dorsal के भी पीछे वाला. Is it clear? Now on the medial side it is just divided into 2. So it's simple, these are the medial ones. So one is your ventromedial and another one is your dorsomedial. Now you have two more. In the intermediate part you have two nucleuses over here and over here. So this one is for your phrenic nerve. So this is going to be from C3 to C5 and this one I should write about this over here with some other pen. I'll use violet again. This one is for your accessory nerve spinal root. Spinal root of the accessory nerve, that is from C1 to C4. So your intermediate part में anterior horn के nucleuses are only present in the cervical region. I hope that is clear. And with that we finish up with the important aspect of spinal cord. Blood supply इतना important नहीं है, खुद भी पढ़ लेना और बाद में I'll make a video, but important point spinal cord के यही थे सारे के सारे. Don't forget to like, comment, share and subscribe मेरी मेहनत के लिए. And if you want me to bring more videos, let me know आप लोगों को न्यूरोएनाटॉमी से क्या पढ़ना है in the comment section and I'll try my best to make those. Bye bye, see you.